In 2020, the outbreak of civil war had resulted a massive influx of the refugees to the neighboring countries. Apart from delivering the daily necessities to the treating volunteers in Jordan, in the refugees, the Jordans had witnessed the importance of providing medical care to the refugees. And joining us today is Sister Lemayus, who have worked earnestly together with a headquarters in Jordan for, provide, for providing the medical services to the local as well as the refugees. Without a further ado, let us welcome Sister Lemayus. Over to you, Sister.
Okay, thank you, the master, and all the brothers and sisters in all over the world. Good morning, good afternoon, and good evening. My name is Lamia. I'm working in the Tzu Chi branch in Jordan. Today, I'd like to introduce you about how Tzu Chi doing the medical care missions in Jordan. So the let's start the presentation. Okay. The first, this is our outlines about how I'm going to share with you about the Jordan medical care experience. Okay. First, I'd like to introduce you about how Tzu Chi start medical missions in Jordan. We start in 2012 in Ramsa area. It's near the Syrian border. At that time, because the Syrian war, so many refugees, they fled into Jordan. So at the beginning, we support about 30 moms delivery surgeries each month. We continue for 5 months. After that, Tzu Chi TIMA teams, they came from Taiwan in 2014 and 15 also, and 16, also 18 and 19. They came as dentist TIMA teams mostly, and also combined with other doctors, specialists. But for example, this is some cases we have from the Zaatari refugee camps. At that time, they have so many children. Since 2015, the UN, they cut the budgets for medical care. So many children, they need the necessary and urgent surgeries, but they cannot have it. This is one of the babies we helped that time. And they grow up healthily. So before 2 weeks ago, when we have the Jordan 25th anniversary, we invite them to our office, and we are so happy that them can see our master face to face and to say their thank you. So I'm going to use some short videos to show you about what is the story going on. We have the medical day in 22nd July this year. We met one of the patient's mother because have been 7 years we didn't see them, and the mom was so happy to see us. So this is our sister, a senior commissioner, Sister Abir. He said it's in 2016, the TIMA Taiwan team came to Jordan. And they also entered the Zaatari camp, which is a refugee camp that time. That time the situation is very poor because not too much medical care and because lack of funds. So when they know the TIMA Taiwan came to Jordan, they have every day a lot of people come online and waiting to hope they can receive the help. They have many different diseases that time. mostly from genetic because they get used to marry from relatives. So yeah, for example, like this baby, is okay. This one, we bring them to Amman to hospital for the child surgeon specialist, and each one of the baby, they have to go through 2 or 3 times surgery to be normal. Okay, let's continue about the PPT. So during that time that we have cured about 25 children, and they have many strange disease like the inflamed annulus and hermophasaurus and hernias. So how I like to explain to you how the patients in need reach us. After 2020 March, then the the pandemic started, so it affects the international traveling. TINA group is not able to come to Jordan, but still we arrange with the local doctors. Each 6 months, we have a group, a team of the doctor. We go to the very poor area, like the Mafraq area, because it's mostly the refugee camps. And also Ain Basha area, which is in Amman, but the most residency there are very poor people. We will have provide the free checkups and free medicines. And if they need further treatment for surgery and examinations or lab works, also we can provide them. The second source that we will get the report from our Syrian doctor team. We have a cooperated hospital. Its name is Bayadir Hospital. Our doctor have clinics there, and most of the patients can come to them and pay very few fees for checkup. If they need urgent help and they are really in need people, our doctor will report to us. Then we have to do very good case study to accept it or not. Also, we have also 1,700 families already in our charity account list. When they are in need, then we can help them. So far, the healthcare, we focus on the Syrians or refugees, the non-Jordanians, because the Jordanian, they can visit the government doctors. And also the Jordanian, they can get the insurance or the help from the Jordanian government. But for the foreigners, they cannot. That's why, because in following the Tzu Chi spirit, respect life, we have to help them. For example, the following photos, they are the medical day we did in Mafraq, in Amman. And how is our principle to accept the patient or not? Because we focus on children who is under 18 years old, we can help up to 100% of surgery charge and medicine. Because the children is very important. They have the future and they need to study so later they can work. For the patients who the age is between 18 to 40 years old, we can help them up to 50% because during this age, they're supposed already working or they have the family support. For the patients, the age over 40 years old, because we think we should that their family also carry the responsibility, not totally depend on other people or through the responsible bond to others. So we can help up to 25%. But still, there are some exceptions. Because all the cases come to us, we have the employees to get the full information from them. Through the interviews, through the telephone interviews, we need to know the name, age, nationalities, when they are working, and also the what is their monthly incomes, which area they are living, and how many family members. Because we need to know every details, then we can make the good report, and we will report it to Brother Chen, our CEO. So he will guide us that how much we can help, and then to understand the family situations. Later on, we also do the home visit to understand what else help they still need. In each individual case, we must take complete consideration because each person has a family, and we have to use our compassion with the wisdom to evaluate. Because when we plant one seed of the goodness, it can grow to infinity goodness. Then I like to share with you about another medical cases we had.
曾经是个清秀的小男孩，欧萨马在2011年叙利亚战争发生时。
This boy we saw in the photo, this is a Syrian refugee. Since he was 6 years old, he started have the colon diseases, which make him cannot go to school, cannot eat, cannot sleep, cannot walk. He reached to us in 2019 in June. At that time, he's already 14 years old, but his weight is 17 kg. Because the refugee, they are very poor and they really need help. And his family, his father and mother are very old, cannot work.
在2011年叙利亚战争发生时，得了一种怪病，没人能医治。
He has a serious problem in his abdomen. He can't eat. He is very weak. The disease called Crohn's disease. The problem has arrived in his back. In his back, there is a stool coming from his back, from here. If we let him go back to the home, I think we go to his blood, and we may lose him.
克隆氏症是一种发炎的疾病，好发于肠胃和肛门，发病原因多半跟遗传或是环境有关系，需要长期治疗。
عند الطفل أسامة المريض من 6/2011
1个月后，欧萨马已经可以扶着病床站起来了。
结果他跟某安娜打电话给我说：“你得症你赶快过来。”我说：“他已经没有。”他说：“不行，有个很大问题要决定，就是那时候呢要打1个月。”
So at the beginning, we make him the surgery, but after that 1 month, he finally can start to walk. But he need the IVIG, which is a very expensive medicine here. He need 3 injections each month.
他打3针，1针呢是400个气体。
这种人体免疫球蛋白注射液针就要台币17000元。慈济约旦分会执行长陈秋华只好再度跨海求援。这一次，慈济人医会药师王志明再次慷慨解囊。
And we have to thank one of our brother, Dr. Wang from Taiwan. The brother Wang, he donated the injection to Jordan to help this baby.
上的，因为秋华师兄，我们有可能累世跟他有这样的因缘，然后我们可以跟他结这个好缘。抱一下，谢谢。
一个孩子的未来终于在此时露出曙光。这天，在约旦首都安曼的阿贝亚德医院传出了令人振奋的消息。
I was impressed when I saw him moving yesterday. It was amazing for me. Really. So I think that we do something very, very to help this baby. For the therapy, the coach, everybody help that baby. This obvious.
Recording in progress.
Yes, yes, yes. When the little children Hassan
Recording stopped.
And this is very better now. I feel that I want to cry, and something is on my face.
Thank you. Thank you. And yesterday, when I saw him walking, anyway, I don't do anything. Simply, I told Dr. Mohammed, I take this patient only. I feel very happy because I can help only simple words. Thank you, Tucci. Thank you, our master. Thank you, everybody. Help Osama and support him. Thank you very much.
How's Osama? أنت مبسوط؟ الحمد لله.
那个满脸愁容、痛苦的躺在病床上哀嚎的叙利亚男孩已经不见了。在慈济接受关怀的3年里，欧萨玛的人生逐渐翻转。因为健康因素无法入学，慈济为他请了家教。
أجمل الوجوه هي الوجوه المبتسمة.
2019年时，骨瘦如柴的他只有17公斤，如今已经长到30公斤。
Yes, as you can see that it's very amazing that Usama, he can start playing, dancing. He start dancing, playing sport, and also playing football. He's living a regular life, but the only shortage is that because he never one day went to the regular school. So we have also our scholarship students who help him to go to his home and to teach him Jingsi, our wisdom from our master, and also teach him how to read and write. Now he's 17 years old and he's in good health, and his weight is becomes 30 kg. So we are so happy about this result. This was in Amman at the beginning, 2019, when we start to see him. And this is now, it's in this month that we visited his family. Also, I want to share with you with something that he went with us 10 days ago as a volunteer to a poor area in Mafraq as a volunteer. You know, as our master teaching, we have to realize the blessing, and we have cherish the blessing, and we have to create it more blessing. So we are so happy that we not only save his life and he's in good conditions, we hope to develop his compassion and wisdom. That's why we took him out with us as volunteers to see other poor children and make them happy. This is another case. The man in the photo, his name is Ahmad, and unfortunately, last year in January, he passed away because brain cancer. This also one of our long-term care case that in 2018, when we just know him, that time he has 5 children, but he have also the brain cancer. That's why we help part of the surgery cost. But after that, he was begging our branch to say that if we can continue support about the chemotherapy, because he said that my children is still so small. I wish they can remember me even when they grow up and I already passed away. So I think whoever have a heart to hear this kind of begging will not reject him because it's very difficult. So we continue taking care of them. Each month we have a home visit with them, and especially thanks to Mrs. Chen, our sister Doris. She was so patient, and every month in one morning we will bring breakfast and we will go to visit them, to have breakfast with them, to spend all the morning with them, to see how is the children growing, to see how is husband health, and also the mother. We always encourage her to be strong. Even till now, already the husband passed away for 1.5 years, but we still continue visit them every month. And what kind of the medical care service we provide here in Jordan? Mostly is the surgery. Second is the treatment such as MRI, CT, lab tests, or medical shoes for glove foot babies. Also, we have provide the medicines, whether it's the short term or it's the long term. We have 2 diabetes babies. They need the injection and they need the tester refill. And I like to explain to you what is the special for Tzu Chi's medical care. Because we care our patients and treat them with love and respect. And we also become their family and friends. Like we regular home visit. So they really very trust us very much. And any problem they have, they will call us and to asking for help or something. Sometimes to listen to them, maybe it's not because material support, but it's very important. It's the emotional support. Because we can give them the feeling that they are not alone, and still some people is really care for them and will help them. Especially for the long-term patients, we provide some of them the monthly family support because Master Zheng Yan said that some people, they become sick because they are poor. And some people, they become poor when they get sick. And here is another story I like to share with you. This baby we have been taking care of 4 years. She has the growing hormone shortage. So when she was 8 years old, the school teacher told her mother that she doesn't have the normal growing. That's why the mother through the doctors and find us.
From Taiwan. He wants to visit you at home to see Rujai and to see what he had problems. So he comes to my home and I give him a report of the doctor. So he will see Rujai and take him in care. When she's going to school, her teacher talked to me. She told me, I think Rujai is not okay. No, doctor made this. She told me he's good.妈妈是约旦人，爸爸是叙利亚人。卢珍一出生就罹患了地中海型贫血症。
And 2011, when the Syrian war started, her father went to jail. After 2 years, they told then the mother bring 5 kids and run away to Jordan. But after 2 years, they informed the mother that the husband has been passed away. So for Rujen, during the war, and the mother was worried, and they live in bad conditions. So her nutrition is not so good. That's why she has this hormone, the shortage, the growing hormone, the issue. And because the problem is the growing hormone is very expensive here. So again, our brother Chen went to Taiwan and still look for the help from our brother. So that because all the situation, so we find the help from the Dr. Wang again.
来赞助这个药。这个经验之后呢，他一定要
终于遇见了贵人。
对对对。
渐渐的，卢珍从2017年的104公分长到2021年的136公分。
Change him. I change him. Yeah.
安心的在睡着了，就像他的画里，娃娃都有一双长腿。卢珍是不是也能顺利长大，奔向未来呢？让我们一起为他集气。
And because for Rujian case, she always drawing the painting the human has a very long leg because she cannot grow up. But it's very good that she's normal size now. So also about the 7 subjects, I like to explain to you that how the Tzu Chi's medical care created miracles like those examples we see by our eyes in Jordan. One of our under training volunteer, brother Abu Ahmad, he taught us. He is a Muslim, but he said that because Tzu Chi's donation is all from the small amount by many people. When everyone carry a pure and clean heart and the good wishes, the small money will become blessings. And these good wishes or prayers in Islam's explanations is the only way to change the fate or destiny. And really, I really thank you for everyone all over the world who is always have a pure and good heart and collecting the small even changes. All this money together, they really created a lot of medical miracles in Jordan. Even some doctors, they cannot believe what we have done. For example, for this boy, he found us last year in Mafraq Medical Day. That time he was 13 years old. He has one bone is broken in the arms 2 years ago. But he doesn't have the money for continue the treatment. So we can see from the x-ray that actually his bone is melt. So in this situation, we need to find him a good doctor for bone transplant. So thank God in March that we bring him to Amman and we start the bone transplant surgery. After that 1 month, he come back for checkup. Then when the doctor removed the gypsum, this boy has an unbelievable smiling on his face. He cannot believe. After 2.5 years, he finally can move his fingers. Because the past 2.5 years, he always hide his hand inside the jacket when he went to school. Because other children will laugh at his arm. Also, I have to share with you another example for our medical cases.
肿大的左手臂是努尔痛苦的来源。从帐篷区送。
This girl, her name is Noor. She living in Mafraq in camp area. He has a bone cancer, and actually his arm near the shoulder area is bigger than the basketball. When he reached to us, it's already the last 5 days in her life. Her cancer actually already is spread to all her body, and we try our best, try to help them. Even that time,
腹部清创手术，女孩痛苦哀嚎，听在母亲耳里是心碎的声音。
السلام عليكم ورحمة الله وبركاته. أنا الدكتور محمد حمزاوي.
at that time, our doctor examined her and tell us that she is very weak and her cancer cannot be cured. But because she is in great pain, so we are hoping that we can at least do something. Then that time we also find a very, very good surgeon from the military hospitals, and the surgery, we do the amputation. That time, actually the situation is become better. After the amputation, she was awake, she can eat, she smile, she talk to her father and mother. But unfortunately, after that 1 hour, she just suddenly
努
passed
尔
away.
尽全力争验，在术后复原时期，却依旧传来不幸的消息。
We have lost Noor this morning at 9 o'clock. Suddenly she has death. Before that, she was very good, but suddenly she has death. Thank you for Jushi team for following and helping and supporting this care. Thank you very much.
I like to explain to you that some cases when they came to us, it's already very late. So that time our goal is to release their pain and suffering. And also the most important, to also help to comfort their family feelings. Because we do our best in humanity as the Tima mission, that hand over your body to the doctors and hand over your heart to the heaven. For my experience sharing, I like to share with you all that the life is really impermanent. You know, exactly like our master teach us. We have only the right to use our life, but we don't have the right to own our life because the life is only between breaths. So in fact, the Noor case, the bone cancer girl, it's my first case when I start to work in Jordan with Tzu Chi. And really, this gave me very big shock because I see a life just disappear in front of me in 5 days. We all know that time her situation is very difficult, but we try our best, but still at the end, we cannot save her life. So it's really, you know, like when the doctor told us, oh, today she's better, we feel so happy. Then maybe afternoon, then the doctor told us, no, her blood is come to only 2. We cannot persist the surgery. So we will feel so worried about her. But at the end, we all wish she went to a better place because we did our best. And after that 1 month, we also visit her mom in the tent area because they are the Syrian refugees. We can see the family, how much they will have the pain and suffering after they lose their family member. But they also understand that Tzu Chi is doing not only the surgeries or medical help. We really care for them. We stand by them like the family, like the brothers and sisters. During seeing so many cases, that so many babies we send away, so many already the last stage people, we comfort their family, we stand by their family. What I feel exactly is Actually, those cases show me what is the life. Not do I help them or I save them. No, it's in the opposite. Actually, they saved my life. Because after you see the life can disappear so fast and so easy, I feel so grateful for each minute that I'm breathing and I'm still working, and I'm working with a group of excellent, kind-hearted people to help the others, to help the people who are in suffering. You know, exactly that our master carry a very good and very great vow that we are saving each of the suffering life. So I feel so grateful that in the life, what is the important thing is to be kind with everyone around you and to embrace who mean a lot to you. Life is very short and unpredictable. We have to use very valuable time, even just 1 minute, to do the good thing to the world. And thank you for your listening.
Thank you, Sister Lavinia. It's for wonderful sharing. I guess the stories in Jordan, they're just not just in providing the medical care, but they serve as the families who be there and the companionship that brought a lot of love towards the recipients. And once again, thank you, sisters. And the true happiness is really measured by love and not by one's possessions.